Hey, what's happening? Simon again in Tokyo. We're listening to Naked Eyes, Promises, Promises. Sounds of the 80s. Okay, let's talk about this problem we have here. A question. A 33-year-old man comes to the clinic because of abdominal cramps for the past 5 months. His older brother has had similar episodes in the past. He has recently lost 10 pounds unintentionally and has occasional diarrhea, sometimes with blood. He denies nausea, vomiting, constipation, and food allergies. Which of the following is most closely associated with the likely diagnosis? And if you're reading into this, you can imagine that the diagnosis here is Crohn's disease. So the choices here are A, ankylosing spondylitis, B, inflammation of mucosa and submucosa only, C, markedly increased risk of colon cancer, D, non-caseating granulomas, or E, pancolitis involving the rectum. So when I read this first, I answered ankylosing spondylitis, but this is wrong. The answer is non-caseating granulomas. Why is it not ankylosing spondylitis? Ulcerative colitis, more often than Crohn's disease, is associated with various extracolonic manifestations such as ankylosing spondylitis and spondyloarthropathies. Ankylosing spondylitis is characterized by back pain in a younger individual as well as the bamboo sign on radiographic imaging. Uveitis is the most common extracolonic manifestation in IBS. So this was non-caseating granulomas as the answer here. So the major takeaway here, Crohn's disease, unlike ulcerative colitis, is associated with non-caseating granulomas. A number of other factors distinguish the two features, the conditions, including the site of origin, the pattern of progression, the thickness of inflammation, and any predominant symptoms, complications, radiologic findings, and risk of colon cancer. So remember that Crohn's disease, unlike ulcerative colitis, affects the entire thickness of the colon and may cause fistulae, abscesses, and fibrotic strictures. Non-caseating granulomas may be visible in 15 to 30% of biopsy specimens and 40 to 60% of resected bowel. Management of Crohn's disease includes lifestyle changes, medication, and often in cases of intestinal blockage, surgery. So there we have it. A good question. Thanks very much for tuning in, and we will see you again next time. Let's listen to this song one more time.